In today's video, we'll take a look at alcohol and its association with alcoholic liver disease. How much and for how long is it safe to drink alcohol? Alcoholic liver disease is a major cause of chronic liver disease worldwide. And alcoholic liver diseases span a wide range of diseases of increasing severity that includes steatosis or fatty liver, steatohepatitis or inflammation of the liver, fibrosis or hardening of the liver, and cirrhosis. People who have advanced stages of cirrhosis have a median survival of a mere 1 to 2 years. And a full half of all the people suffering from severe alcoholic hepatitis will die from their disease. It is estimated that a full 2.3 billion people drink alcohol regularly. But do they know how much and for how long they can drink alcohol safely? In the Western countries, the number of people who die from cirrhosis is directly proportional to the per capita consumption of alcohol. Our livers process about 90% of the alcohol that we drink, and the remainder is excreted in the urine, in the skin, and in the breath. As alcohol is processed in the liver, a substance known as acetaldehyde is formed, which can damage the cells in the liver, so that the more alcohol we drink, the more liver cells are destroyed. Processing of alcohol in the liver can sometimes lead to an inflammatory process that can cause the formation of inflammatory cytokines such as tumor necrosis factor alpha and interleukin 6. But whether or not we develop alcoholic liver disease depends not just on the amount of alcohol we drink, but also on the duration of time spent drinking alcohol. Aside from this, there are other factors that can influence the likelihood of developing alcoholic liver disease. Infections with hepatitis B or hepatitis C, genetic predisposition, being obese, poor nutrition, or having the metabolic syndrome can all increase the likelihood of developing alcoholic liver disease with the consumption of alcohol. The pattern of drinking also modulates the risk of developing alcoholic liver disease, in that people who drink intermittently and people who drink only when they're eating are less likely to develop alcoholic liver disease than people who drink continuously and people who drink in between meals or without eating. But no one wants to develop alcoholic liver disease. So how much and for how long can we drink alcohol safely? From January of 1991 to December 1993, scientists conducted the Dionysos Study in 2 separate towns in northern Italy. This study examined the prevalence of liver diseases in the general population. Results of the study showed that liver damage only usually occurred after a lifetime consumption of 100 kilograms of raw alcohol. The National Institute of Alcohol Abuse and Alcoholism has defined one drink as 11 to 14 grams of raw alcohol, which is the amount of alcohol contained in a 12-ounce can of beer, which is usually about 5%, or a 5-ounce glass of wine, which is usually about 12% alcohol, or 1.5 ounces of spirits, about 40% alcohol. In the Dionysos Study, people who drank less than 30 grams of alcohol daily, about 1 to 2 drinks a day, did not develop alcoholic liver disease. Above the 30-gram threshold, the incidence of alcoholic liver disease and cirrhosis increases linearly with the amount of alcohol consumed. People who drink more than 30 grams of alcohol daily for 10 years will likely develop alcoholic liver disease. And heavy drinkers defined as people who drink more than 80 grams of alcohol daily for 10 years, will develop cirrhosis of the liver with almost 100% frequency. Very heavy alcohol consumption, 120 to 150 grams per day, or about 4 to 5 drinks per day, is enough to cause hepatic steatosis or fatty liver in as few as 2 to 3 weeks. One good rule of thumb is if you drink more than 2 drinks per day for up to 10 years, you will very likely develop alcoholic liver disease. Thank you for watching. I hope you found the video useful. If you did, share this video with your friends and family. Show your appreciation for the channel by subscribing to the channel. Until the next video, stay healthy and stay safe.